Understanding white vaginal discharge, causes, health implications, and when to seek help. Introduction. White vaginal discharge is a common occurrence for many women, often eliciting concern and questions regarding its normalcy and health implications. While discharge is a natural part of the vaginal ecosystem, its characteristics can vary widely. This article delves into the causes of white vaginal discharge, examines its health implications, and offers guidance on when to seek medical attention. The role of vaginal discharge. Vaginal discharge plays a crucial role in maintaining vaginal health. It serves several important functions, including lubrication. Discharge keeps the vaginal tissues moist, reducing friction and discomfort during activities such as walking and sexual intercourse. Protection. The mucus in discharge traps bacteria, dead cells, and other foreign particles, preventing infections. Cleansing. Regular discharge helps to expel old cells and bacteria from the vagina, maintaining a healthy environment. Normal versus abnormal discharge. Normal discharge. Healthy vaginal discharge is typically clear to milky white and may have a mild odor. Its consistency and volume can fluctuate due to hormonal changes throughout the menstrual cycle. For instance, discharge may be more substantial and stretchy during ovulation, while it can become thicker and whiter in the luteal phase post-ovulation and before menstruation. Abnormal discharge. Changes in color, consistency, odor, or amount of discharge can indicate an underlying health issue. Abnormal discharge may be yellow, green, gray, or have a strong, unpleasant odor. Accompanying symptoms like itching, burning, or irritation further suggest an infection or other medical condition. Causes of white vaginal discharge. Physiological causes. Hormonal fluctuations. Hormones play a pivotal role in regulating vaginal discharge. Estrogen and progesterone levels influence the amount and type of discharge. During the menstrual cycle, variations in these hormones lead to changes in discharge characteristics. Ovulation. Mid-cycle ovulation increases estrogen levels, resulting in clear, stretchy discharge. Post-ovulation, progesterone rises, leading to thicker, white discharge. Sexual arousal. Sexual stimulation increases blood flow to the vaginal area, leading to a temporary increase in clear white discharge as part of the body's natural lubrication process. Infections. Yeast infections. Candidiasis, a common cause of thick, white, clumpy discharge resembling cottage cheese. Yeast infections result from an overgrowth of Candida albicans. Symptoms often include itching, burning, and redness. Bacterial vaginosis, caused by an imbalance in vaginal bacteria. This condition produces thin, white, or gray discharge with a fishy odor. Bacterial vaginosis may also cause itching or burning, especially during urination. Sexually transmitted infections. STIs. Certain STIs, such as chlamydia and gonorrhea, can cause abnormal discharge. This discharge may be white, yellow, or green and is often accompanied by symptoms like pelvic pain, itching, and painful urination. Non-infectious causes. Irritation or allergies. Exposure to irritating substances such as soaps, douches, or spermicides can lead to increased discharge. Additionally, allergies to latex condoms or other products can cause vaginal irritation and discharge. Foreign bodies, forgotten tampons or contraceptive devices can cause an increase in discharge, often accompanied by a foul odor and discomfort. Medical conditions. Conditions such as diabetes or autoimmune diseases can affect vaginal health, potentially altering the characteristics of discharge. Health implications of white vaginal discharge. Healthy discharge. As previously mentioned, white vaginal discharge can be a sign of a healthy, functioning reproductive system. It indicates that the body is naturally cleansing and protecting the vagina. However, the line between normal and abnormal discharge can be thin, requiring women to be vigilant about changes. Indicators of health issues. Yeast infections. While common and treatable, recurring yeast infections can indicate an underlying issue such as diabetes or a weakened immune system. Bacterial vaginosis. Left untreated, bacterial vaginosis can lead to serious complications, including an increased risk of STIs, pelvic inflammatory disease (PID), and complications during pregnancy. STIs, unaddressed sexually transmitted infections, can cause severe reproductive health issues, including infertility, chronic pain, and increased susceptibility to other infections. When to seek medical attention, it is essential to consult a healthcare provider if you experience any of the following: a sudden change in discharge color, consistency, or odor. Persistent or recurrent itching, burning, or irritation. Discharge accompanied by pain during urination or sexual intercourse. Unexplained pelvic or abdominal pain. Signs of infection, such as fever or swelling. Diagnosis and treatment. Diagnosis: a healthcare provider will typically perform a pelvic exam and may take a sample of the discharge for laboratory analysis. They will inquire about your medical history, symptoms, and any recent changes in hygiene products or sexual activity. Treatment: the treatment for abnormal discharge depends on the underlying cause. Yeast infections, antifungal medications, available over the counter or by prescription, effectively treat yeast infections. These can be administered as oral tablets, topical creams, or suppositories. Bacterial vaginosis, antibiotics, either oral or topical, are prescribed to restore the natural bacterial balance in the vagina. STIs, treatment varies based on the specific infection but often involves antibiotics or antiviral medications. It is crucial for sexual partners to be treated simultaneously to prevent reinfection. Preventive measures. Maintaining vaginal health and preventing infections involve several proactive steps. Good hygiene: wash the genital area with mild soap and water. Avoid douching, as it disrupts the natural balance of bacteria. Safe sexual practices: use condoms and have open communication with sexual partners about STI testing and prevention. Healthy lifestyle: a balanced diet, regular exercise, and adequate sleep support overall immune function and vaginal health. Avoid irritants: choose unscented and hypoallergenic products for personal care. Avoid tight clothing and non-breathable fabrics, which can create a moist environment conducive to infections. Regular checkups: routine gynecological exams help detect and address issues early, ensuring long-term reproductive health. Conclusion: white vaginal discharge is a natural and often healthy part of the woman's reproductive system. Understanding the normal variations and recognizing signs of abnormal discharge are essential for maintaining vaginal health. By staying informed and proactive, women can confidently manage their health and seek medical attention when necessary, ensuring their well-being and peace of mind.